Women are known to be multitaskers. We're dealing with work issues, family issues, social expectations, financial pressures, and all that can be a lot. Chronic stress is very, very big as far as wellness is concerned because it's got multiple effects on the health. So it will affect metabolic, cardiovascular disease, mental health, and so forth.
Hello, everyone. Welcome back to your Health Matters podcast by Sorogi, a show that is dedicated to empowering people with strategies to prevent complications of chronic health conditions and to allow you to live your best life. I am your host, Dr. Vivian Ayuk, and joining me today for part 2 of our series on women's health and wellness coaching is Dr. Valerie Tagwira. She is an experienced OBGYN, really passionate about supporting women with the tools needed in every stage of their lives. She's also a new member of our Sorogi family, and she will be leading the Women's Health Program. Today, we are going to explore practical strategies for women to live healthier and more intentional lives. Dr. Val, welcome back to the show.
Thank you very much, Dr. Viv. It's a pleasure to be back on your show again.
You are welcome. We love it when you're able to stop by. Thank you for accepting our invitation again and joining us. So today, before we get going, I know our Sorority family members know who you are. You're no stranger to them. But for those who are joining us for the first time, can you share a little bit about what you do and your passion for this work?
All right. As Dr. Viv has said, my name is Dr. Valerie Tagwira, but you can call me Valerie or Val. So I'm a specialist obstetrician and gynecologist with a passion for wellness. And this has come out of my years of experience as a clinician, managing women and realizing that while we have this clinical interface where we're thinking about pharmacological and surgical therapies, a lot of the conditions that we do address can be prevented through wellness strategies that incorporate lifestyle and other measures that we're going to be discussing about in this series. So my passion really is now more focused on prevention as a strategy that is much, much better and able to give us better treatment outcomes when compared to just waiting for disease to happen and then trying to deal with it at that point.
I appreciate that because that was going to be my next question, which is how has your work with women really shaped the way you approach health? But from your experience, though, what are some of the most common health concerns that women come to you with that are not always talked about? Or we don't talk about it enough?
Well, we don't talk enough about exhaustion. Women are known to be multitaskers. We're dealing with work issues, family issues, social expectations, financial pressures, and all that can be a lot. So if a woman then starts feeling fatigued, it's almost taken as something to be expected because of that multitasking. However, there can also be some underlying medical conditions which are bringing that exhaustion, brain fog to the fore. And then the other things that are not often talked about, sexual wellness and pelvic floor function. I feel that we could do more as the health the health community to conscientize women more about the importance of that aspect of health. The other one has to do with chronic stress. While it might not be thought of as being a direct medical condition per se, because it commonly arises from social issues, chronic stress is very, very big as far as wellness is concerned because it's got multiple effects on the health. So it will affect metabolic, cardiovascular disease, mental health, and so forth. So I think it deserves much more recognition than we actually give it. Those are just some of a few of the ones that are not talked about as much as they should.
We're hearing a lot about menopause. Where does that fall among the things that you're seeing in clinic every day?
It's an
Would you say
important
that would be among the top 10 of the issues that women don't really think about a lot, especially around the symptoms and maybe their increased risk for other health conditions?
Absolutely. I really think so. And part of the problem is that even as we are being trained as doctors, it's not given as much attention as it should, considering that it's going to be affecting half of the population at some stage in their lives. So that's part of the problem, that we're not proactive enough in questioning women, inviting them to share with us their experiences at that stage of life. And also going back to the society, it's also taken as just one of those things that are part of life. You just bear grin and bear with it, so to speak. But when we really come to the nitty gritties of how it affects how women's bodies work, and the consequences thereof, then we can all then appreciate that it's quite significant, and it should really be one of those top issues for not only after women have reached menopause, but even in the years leading up to menopause, because it's going to affect cognition, sense of self and identity, cardiovascular and metabolic risks, as well as bone health and strength, independence, just physical wellness, so to speak. And it's affects so many areas of women's lives. We might say that some women are affected more than others, but still it does deserve the attention that it's not getting at the moment, in my opinion.
Know everyone now is talking about longevity. There are questions around aging. What's that looking like when you see patients in practice? Are you getting a lot of questions about women trying to live longer, stay younger, and all of that? Because I know the longevity business now, it is booming and there's so much talk about it. So, are you getting any kind of questions around that? People wanting to stay as young as possible, especially women?
Yes, actually, we do get a lot of questions around longevity. But if I look back a few years from now, the conversation is actually changing. So, whereas longevity would have meant looking good as you get older, now women are asking better quality questions. So, it's all about, how can I retain certain aspects of good health as I age? So, it's not about looking good only anymore. How do we maintain cognitive function, physical strength, balance, independence, and how do we thrive as women as we get older, rather than just it being a narrow focus on looking good?
That's a really good way to look at it, because if you're on Instagram and all the other social platforms, it feels like everyone is only focused on the looks, but it's great to know that that conversation is not limited to just the outward appearance, and people are more concerned about their overall health. So, Dr. Val, how do daily habits like our diet, sleep, stress, and also movement or lack of movement truly affect women's hormones?
All those factors that you discuss or that you list there, the women's hormones are actually quite exquisitely sensitive to a disruption in any of those that you've listed there. So if we take chronic stress, for instance, it's going to affect insulin and cortisol, which directly impact negatively on the cardiovascular health as well as metabolic health. And as you know, that's the core of a lot of chronic diseases as they are experienced by women. And if we look at nutrition, it's going to have a positive or negative effect on reproductive hormones such as estrogen, depending on which way you're leaning. And we're going to go into that a bit more as we discuss women's health in future podcasts. So those are just a few examples that I immediately come to the fore. But definitely, yes. I had forgotten poor sleep. Poor sleep is a very important one. Again, spikes cortisol and also affects estrogen.
What about bone health and our risk for fractures as we age?
That risk is amplified at menopause, but it's a risk that starts to sort of build up as women get older. So there's bone loss. It can be prevented by weight-bearing exercises, eating well, so high protein in our diet or adequate protein in our diets, enough of calcium and vitamin D. All those are known to strengthen bone health. And it's important to look at prevention from that aspect, because once bones become thinner or start to become thinner at menopause and beyond, the risk of fractures is amplified, and any damage is really difficult to reverse at that point. So it's way better to prevent. But even so, women who do have bone health issues in menopause can still take treatment and also continue with weight-bearing exercises and a balanced diet to try and maintain and possibly improve on their bone health under the guidance of their healthcare practitioner. And the core, again, has to do with that fall in estrogen during the perimenopausal years and beyond menopause.
Thank you for that. Can you talk about like real world situations where you have seen lifestyle make a difference?
If I can pick on some very important ones, stress management or avoidance of stress as much as possible, good sleep, healthy diets, and movement, exercise. So all those, when combined, we've seen women, when you're looking especially at diabetes, hypertension, and other metabolic disorders, you actually see women coming off their meds in some instances or reducing their doses. And those who are known to have familial or otherwise known risks for any of those conditions, actually improving their outlook in such a way that they then end up significantly reducing the risk so that they do not develop those conditions where they were at a point where they are projected to be at high risk. So lifestyle actually does have a very, very positive impact on improving disease outcomes in general.
Thank you. A lot of our participants either going through menopause right now or they're postmenopausal. And there's always a lot of questions as to what to do next. Does it make sense? Especially those who are experiencing symptoms of menopause. And there's always this question, should I take those hormone replacement therapies? Is it for me? What are the risks and the benefits? Is there something you could share with, or can you share with our audience, right? What these medications are, some of the benefits and possible side effects?
Um, Hormone replacement therapy has had over the years very negative or a lot of bad press, but there is a place for it. So for the right woman with a specific indications or a set of symptoms at the right time, it can be a life changer. Okay. So let's say women are experiencing hot flashes, which are so bad that they cannot function at work, or they're getting brain fog, and or maybe they're even experiencing sexual difficulty. I'm just mentioning three there. For those women, hormone replacement therapy can be a life changer. But you look at it again on the flip side, there are risks associated with hormone replacement therapy, which brings us back to saying there is a place for it for the right woman who's had that discussion with her doctor and has made an informed decision to see whether any known or theoretical risks can be amplified by taking hormone replacement therapy. And a big one, which is always at the back of the mind of many women, from my experience as a clinician, is, will this cause me to get breast cancer? Okay, this is how it's framed. It's a very big concern for a lot of women, which is why we always encourage women to say, sit down with your doctor. If you have concerns about cardiovascular diseases, metabolic diseases, risk of any other conditions such as breast cancer and so forth in relation to hormone replacement therapy, by all means, you will get an assessment from the doctor and, have a very honest discussion about what these risks mean for you as an individual, and then come to a decision about whether you are at that point going to benefit. And we also should remember that hormone replacement therapy is not only systemic, whereby women are either taking tablets or using gels, which are applied on the skin, or some other form which is delivered to all tissues in the body. There is also vaginal estrogen, which can be used in a very localized way, particularly for those women who are experiencing sexual problems related to estrogen decline, and consequently vaginal dryness and so forth. So the other hormones which are used as an adjunct to HRT or hormone replacement therapy are also progesterone as well as testosterone, depending on whether a woman has got a uterus and what symptoms she's experiencing and so forth. So again, it becomes a very individualized and specific discussion for each woman and her doctor.
I'm glad you mentioned that, Dr. Val, because a lot of the times we get questions from participants around how to prepare for their doctor's appointments. They're not sure exactly what are the right questions to be asking. And for women experiencing menopause, or just any woman for that matter, there's some things we think is part of life, and no one is really paying attention or ignoring really important symptoms, right? Some of the things that you think every woman should be asking and preparing, and how can they better prepare for their doctor's appointment?
All right, thank you, Viv. So before the appointment, every woman should be thinking, what are my symptoms? There is no symptom that is ever too small. Okay, so because even those symptoms which are considered to be small might actually be the beginning of something serious. So have your symptoms ready, and if it might help, it's good to write a list down so that nothing gets forgotten during the discussion. And if necessary, be in that frame of mind where you're thinking, if my symptoms are not heard, or if I'm not going to get the attention that I need, I would like to become an advocate for health. Self-advocacy is very important when it comes to interacting with the healthcare system. So within the appointment itself, women are encouraged to not only give a list of their symptoms, but also to ask questions and to understand what might be perceived as normal and what requires further attention. And quite importantly as well, why? Why is a very good question to ask, because we find that when women understand better why certain things happen, they are also better able to work with their healthcare practitioners when it comes to certain plans of care, some of which they might not think easy or comfortable for them. So a lot lies in them understanding their condition. And at the same time as well, they should have that platform where they feel that they can ask for a second opinion if need be. So women should not feel hesitant to ask for a second opinion. It is their own health. And as I've said already, they should be their own self-advocates. So this is how I think women should approach medical consultation as they interact with their healthcare providers.
That this is why I am so excited, and I can't wait for us to launch the women's coaching program, because I feel like every woman should be able to have this information, know
Mhm.
how to approach it, and feel comfortable asking those questions. So I am super excited. Our participants are in for a treat. And the wellness coaching program is really going to make a difference, I believe, in empowering and educating women on how to be able to take better care of themselves. So truly, truly excited to see where that would go. But before we close out for today, you are a doctor, you're a clinician, you're an educator, and you also identify as a woman. So, what are some of the things that you have implemented in your own life? What are some of the strategies that you have actually put in place and have made a huge difference for you? Because we got to believe in our own medicine, right?
Absolutely. For me, in my own life, it starts with a recognition that being a clinician does not make me immune to all the challenges that every woman faces. So my first one is self-care. Self-care is not indulgence and it's not a luxury. And feeding into that is setting boundaries, very clear boundaries, knowing when to say no and when to regulate my workload and my social and family responsibilities to something that I can manage. Because if I overdo it and take on more than I can manage, I'm not going to be any good for anyone, really. Okay, so this is where it starts for me, self-care. And then I look at what I eat. I'm very strict about that. And exercise is mandatory for me. And then I also make sure that I practice sleep hygiene. It's a bit difficult because I'm kind of addicted to my phone and the computer. So sleep hygiene before I go to bed, screen time, making sure that I've done what needs to be done and put the computer and the phone away. That's a big one. And making sure that I get about 7 to 8 hours of sleep every night, except when I'm on call. And just being kind to myself because the world might forget. So those are the few that I try to incorporate into my day-to-day life so that I can live a healthier life. Of course, there's always room for improvement.
Like that. Be kind to yourself because the world might forget. That is a powerful message there, and I think every woman needs to hear that. Before we wrap things up, what is one message you want our audience to walk away with after listening to this episode?
I'll frame it as one thing for the women to walk away with, or all our listeners, there might be some men listening as well, is please listen to your body and take care of any symptoms that you're experiencing and believe what your body is saying to you because you know yourself. As you approach the healthcare system, be yourself advocates. And then lastly, please attend your regular screenings on schedule, right on time, because they might be one of those things that is life-saving in the long run. Thank you very much.
No, thank you. We truly appreciate you today taking the time to join us and all you do for our community. Thank you, Dr. Val. Well, everyone else, that's it for our show today. If you find this helpful, please share it with your friends and family. Also, don't forget to subscribe to our YouTube channel, drop comments, ask follow-up questions for Dr. Val. We truly appreciate your support. And until next time, remember your health matters. And that's it.